This is my note card. I'm gonna place it on her thigh for this particular process. I'm gonna ensure privacy and perform hand hygiene. Okay, my name is Tashana. I'll be your student nurse from NCCU. Can I see your wristband, please? Can you state your first and last name for me?
Anaya Davis.
Okay, and what's your date of birth?
10/9/6.
Okay, so today we're gonna do a head to toe assessment. And first I'm gonna go by inspecting your head. The head is normocephalic. Ears are bilaterally symmetric. There's no lesions or no inflammation. There is no drainage. Eyes are bilaterally symmetric. Sclera is white. There is no inflammation or any lesions or any drainage. Nose is midline. There is no septum deviation, no polyps. Skin color is appropriate for race and it is evenly distributed. Now we're going to palpate the trachea. Do you feel any pain or any tenderness?
No.
Okay, no goiter was noted, and trachea is midline. Okay, now we're going to start by palpating the sinuses, starting with the frontal sinus. Do you feel any pain?
No.
Okay, and we're going to do the maxillary sinus. Do you feel any tenderness or any pain?
No.
Okay, so now we're going to palpate the lymph nodes. We're going to start by palpating the pre-auricular lymph node, the posterior auricular lymph node, the occipital lymph node, the jugular-gastric lymph node, the submandibular lymph node, the submental lymph node, the posterior cervical lymph node, the superficial cervical lymph node, and the deep cervical lymph node. Then we're going to palpate the supraclavicular lymph node. Did you feel any tenderness?
No.
Okay, so now we're going to test the cranial nerves. First, I'm going to start off by testing cranial nerve 1. So I'm going to ask you to place your hand on your right nostril. Okay, I'm going to ask you to breathe in. Okay, and now put your hand on your left nostril and breathe in for me. Okay, cranial nerve 1 is intact. Now we're going to test cranial nerves 3, 4, and 6. First, we're going to start off by telling you to look at my finger and keep your head straight, okay? And just follow my fingers with your eyes. Okay, and now we're going to test the pupils. Okay, look at me. Okay, pupils are equal, round, reactive to light, and they accommodate. And now we're going to test cranial nerve 5 and 7. Can you puff out your cheeks for me? Okay, can you clench your teeth? And can you smile? Okay, and now I'm going to ask you to close your eyes and just say yes if you feel anything.
Yes. 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 Yes.
Okay, and now we're going to test cranial nerve 8. I'm going to stand behind you and I'm going to ask you to cover your left ear and to repeat after me.
Purple rain.
Okay, now I'm going to go on the right side, cover your ear, and repeat after me.
Blue monkey.
Okay, and now we're going to test cranial nerves 9, 10, and 12. I'm going to ask you to stick out your tongue, move it from side to side. Okay, I'm going to ask you to say, ah. Okay, soft palate raises. And the uvula is midline and they're both pink and moist. And we're going to test for gag reflex. So I'm going to ask you to stick out your tongue for me. And, okay, so cranial nerve 9, 10, and 12 are intact. Now we're going to test cranial nerve 11. Okay, so I'm going to put my hands on your shoulders. I'm going to ask you to push up against my hands. Okay, and now I'm going to put my hand on your face and I'm going to ask you to push against my hand. Okay, I'm going to do the other side. Okay, so cranial nerve 11 is intact. Now we're going to inspect the chest. So I'm going to ask you to remove your shirt, if you don't mind.
I don't.
Okay. Try not to mess up your hair. Okay, I'm going to place your shirt here. And do you mind if I touch you?
No, I do not.
Okay, so I'm gonna look at the chest, inspecting the color, The color is evenly distributed. There are no lesions or no inflammation. And now we are going to auscultate the carotid artery using the bell of the stethoscope. Okay, so I'm going to place it and I'm going to ask you to take a deep breath in, breathe out, and hold it. Okay, breathe in, breathe out, and hold it. Okay, breathe in, breathe out, and hold it. Okay, we're going to test the other side. Breathe in for me, breathe out, hold it. Okay, breathe in, breathe out, and hold it. Okay, last one, breathe in and breathe out. Hold it for me. Okay, so there was no bruit noted. Now we're going to go on the other side and use the diaphragm of the stethoscope, and we're going to auscultate the lung sounds. I'm going to ask you to sit up straight for me, and I'm going to ask you to take a deep breath in through your nose and breathe out through your mouth, okay?
Okay.
Okay. Breathe in, breathe out, and hold it. If you feel any lightheadedness or dizziness, let me know, okay?
Okay.
Okay. Breathe in for me. Breathe out. Okay. Breathe in, breathe out. Okay. Breathe in, breathe out. Okay, and I'm gonna lift up your shirt so I can hear it clearly. Do you mind?
No.
Okay. Okay, breathe in and breathe out. Okay, breathe in, breathe out. Okay, breathe in and breathe out. Okay, breathe in and breathe out. Okay, breathe in, breathe out. And last one, breathe in and breathe out. Okay, so no abnormal lung sounds were noted. Now we're going to listen to the heart. Okay, I'm going to start at the atrial. Okay. Go to the pulmonic. Then we're going to go to the Erb's point. Okay, then the tricuspid. Okay, and now we're going to go to the apical pulse. Okay, and I'm going to start counting now. Okay, so the apical pulse was 92 beats per minute. S1 was heard the loudest at the apex of the heart, and S2 was heard the loudest at the base of the heart. No S3 or S4 heart sounds noted. Okay, now we're going to palpate the precordium. Okay, and tell me if you feel any pain or any tenderness.
Okay.
You feel
Yeah.
tenderness? Okay. She feels tenderness at the Erb's point. Okay, do you feel any tenderness here?
No.
Okay. Feel tenderness
Yes.
here. Okay, and she feels tenderness at the myotral point of the heart. Okay, now we're going to test for tactile fremitus. I'm going to put my hand on your chest and ask you to say 99, okay?
Okay.
Okay, say 99.
99. 99. 99. 99. 99. 99.
Okay, so it was noted that the right side of the chest did not vibrate as hard as the left side of the chest, meaning that it's not a symmetrical vibration. Okay, and now we're going to check for chest expansion. I'm going to ask you to sit up straight for me, and I'm going to place my hands here. Take a deep breath in. Okay, breathe out. Okay, the chest expanded symmetric on both sides. And now we're going to go to the back side and inspect the back. My hands crossed, sorry. Okay, so there are no lesions or inflammation on the back, and skin is evenly distributed. Okay, and now we're going to palpate the spinaeus process. Hold your head down for me. Okay. Okay, there is no spinal deviation. Now we're going to auscultate the lung sounds again, using the diaphragm of the stethoscope. Okay, and I'm going to ask you to take a deep breath in through your nose and breathe out your mouth, okay?
Okay.
Okay, take a deep breath in, breathe out. Okay, deep breath in, breathe out. Okay, deep breath in, breathe out. Okay, deep breath in, breathe out for me. Okay, breathe out. Okay, breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, and breathe out. Okay, and breathe out. Okay, so no abnormal lung sounds were heard. And now we're going to palpate for tactile firmness again. I'm going to place my hand on your back and ask you to repeat 99.
Okay.
Okay?
99. 99. 99. 99. 99. 99. 99. 99.
Okay, so the vibrations were evenly distributed across the back bilaterally. And now we're going to do CVA. We're going to do chest expansion. So I'm going to place my hand on your back and ask you to take a deep breath in for me. And breathe out. Okay, so chest expanded symmetrically bilaterally. And now we're going to do CVA tenderness. So I'm going to place my hand on your back and I'm going to ask you if you feel any pain.
Okay.
You're going to feel pressure, but tell me if you feel any pain, okay?
Okay. No.
Okay, now we're going to do the other side.
No.
Okay, so no pain, no CVA tenderness was noted. And now I'm going to ask you to go sit over there. We'll lay down.
Okay.
Okay, I'm going to put this